All right, thanks for being here this evening. I've asked Dr. Paul Lynch to join me. Dr. Lynch, thanks for being here.
Thanks for having me.
Now, I've talked about them before. The Arizona pain specialist. You are the doctor, the guy. You're the guy there. And I've been a patient, and I've talked about my results. But when we were talking about my situation, you were giving me some statistics, almost kind of offhanded, about pain medication. And it really got me looking into this. And I've been shocked and wanted to talk with people about it because I know there's been some bad results. Give me some statistics on death from prescribed doses of pain medication.
Well, first of all, just, kind of joking, but I don't know that I would say I'm the guy there. We have a whole team of docs and professionals over at Arizona Pain that work together in a comprehensive setting. And one of the things we've always talked about from day one, when we first founded our practice, which wasn't that long ago, in 2007, was Dr. McJunkin and myself sat down and said, we really have a problem in America right now with prescription drugs. And we looked at the data, we looked at the research, and we said, you know what? Even if we're the two least busy pain doctors in Phoenix, we are not going to write a ton of pain pills at our practice. We're going to focus on getting people off pain pills, on giving them other solutions, and treating their pain, as I've said to you before, kind of like the way we would for our own mom or dad. Like if our mom or dad had pain and was suffering, what would we want for them? And we've tried to make every decision along the way that that's the way we're going to practice. So what we've seen over the last 5 years has been really interesting. And now, over this last month, there's really been a national spotlight kind of shed on this issue. The statistics are out of control, Mike, to answer your question. I mean, it's become an epidemic, and that is a true word for it. There are about 16,000 deaths per year from opioids, and that's prescription opioids from doctors.
But taken in prescribed doses, not abuse. We're talking about just taking the prescribed doses of these medications. They're just dying from the prescribed doses.
Let me say it this way. It's from prescriptions that are written by doctors. Whether or not they're taking the exact right dose that the doctor wrote is arguable and questionable at times, but often it's exactly the dose that the doctor wrote, and it's too much and it kills them. Other times the patient takes too much. But the bottom line is these medications inherently have very high risk associated with them, and if they are to be used, which we use them all the time in our practice and have had very good success with some of these medications, but if they are used, and I've told you some of this when we've talked, the doctors and the patients really need to understand that they're not a benign treatment. They have side effects, and one of those side effects can be death.
So what do you do? I mean, I look at this, I'm 45 years old, I'm pretty active, always have been. I want to remain active as long as I can, but you deal with medical issues. And so you go to a doctor, and the doctor says, okay, we're going to give you some pain medication to help get you some relief. When does it become dangerous? How does someone like myself, who is obviously not a doctor, how do I know when it becomes dangerous for me?
Yeah, that's a good question. So, when I'm educating patients about pain pills, what I tell them is there's a couple of different groups. One, there's acute pain. If you go to the hospital and you have a surgery and post-op you're having pain, it's 100% appropriate to take a pain pill, and we know scientifically it works really well and it's very low risk. There's other groups of patients, like patients who have cancer, who are at the end of life, and we're using pain pills to palliate and to take away pain. It's a really appropriate usage. What we're really struggling with as a scientific community, as doctors, is this middle group of chronic pain that's non-malignant, like say low back pain. And what I believe in my practice and the way we like to practice is pain pills are certainly not the first thing we're reaching for. And so what we try to do is say, okay, you've been having pain for 1 or 2 weeks. Let's just start with, not much from a doctor. Let's just see what happens. Let's watch it. Now it's been going on for 4, 6 weeks. Maybe we start with physical therapy, very low risk things. It keeps going on. It keeps going on. Maybe we do imaging. Maybe there's chiropractic or procedures we can do. But we're constantly looking for low-risk treatment options to get people back to health without high-risk treatment options. Now, at some point, maybe it makes sense to try pain medicine. What I truly believe and what I educate patients on and other doctors when I speak is if we're going to use these pain pills in someone who's, doesn't have cancer and isn't already dying or whatever, we need to go to great lengths to educate the patient. This is a serious decision in your life if you're going to take this medicine, and then set up a safe way to take it. And to be honest, I don't lead patients down that path very often. I'm not normally recommending the opioids because honestly, it's not what I would want from my own mom or dad. And that's the way I come back to. I constantly try to make the medical decisions based on what would I do for my own family member.
So how does this happen then? Because, of course, everybody says, well, doctors are incentivized to prescribe, you know, the pharmaceutical companies are incentivizing doctors to prescribe it. But if you had the data and you came to this conclusion, the data's out there, and I believe that people get into medicine because they want to do the best for people, why does this happen? I mean, how does this continue to, how has this been the norm for so long?
Yeah, and you know, it's a great question, and I hear this line of reasoning and, you know, talking about incentivizing doctors. I can tell you, being very close to the issue and working with, literally, I've trained thousands of doctors around the country with teaching and training I do on practice management, procedures, and working very closely with docs. I don't think incentivizing doctors is the issue at all, and I truly believe that. I think it's more the good part of doctors, the part that wants to take away pain and suffering, the part of us that wants to make a difference is misdirected in this case. And we have a pill and we say, oh wow, this might help take away your pain. And it does for a period of time. But then after 60 days and 90 days and 120 days, it doesn't work anymore. And so we look in our textbook, and the textbook says you use the pain pill and you titrate it up, which means keep increasing the dose until the pain goes away. So the doctor increases the dose, and then it works for a while, and then the pain comes back. And the good doctor who's trying to help the patient increases the dose again. And I think it's this slippery slope. And what's happened is we don't have a lot of research. We haven't honestly done a good enough job of tracking this over time and really understanding what doses we can use and what doses we can't. And that might sound crazy, right? You go to your doc and you expect there's great science behind it. We know exactly the side effects. But the honest truth is sometimes we don't really know. We've had these medications for hundreds of years, but it's really exploded over the last 25 years.
Now, we always hear that the side effect for prescription medication, pain medication, is addiction. But you say to me 16,000 people a year are dying from this. Why is this not being screamed out? We all know about the dangers of addiction. Why not death being a side effect? I mean, it sounds, I don't mean to make light of it, but that's a pretty serious side effect.
It's exactly, what you're saying right now is what your viewers need to hear, is that death is a true side effect of pain medicine in some circumstances. Now, when used appropriately, your patient should never die. Your patient should never overdose. I can tell you, we've looked at our numbers, and as far as we know, across 30,000 patient visits over the last 5 years, we've never had a death due to opioids. But we're incredibly rigorous in our process. We actually design what we call a 12-step opioid protocol, where if a patient does need to be on opioids, which happens a lot, you know, someone's had 4 or 5 back surgeries and they're suffering every day and they can barely get out of bed, we use opioids often. And when we do that, though, we go through great rigor to set up a safe program. Once again, if it was my mom and she had to be on pain pills, what would I want? Well, I'd want someone doing a physical exam on her every time and looking at her. I'd want them doing a good background check to see if she's ever had addiction or issues with these meds before. I would want them to have her sign a contract and only get medicine, you know, in one place. I'd want someone checking to see if she's getting drugs other places. I don't know if you know this, Mike, but in the state of Arizona, we have what we call a Board of Pharmacy review, where we can pull up a report on every patient that walks in the door and see exactly which prescription drugs they've got from other doctors. We can check those things. But you know what? Not all doctors are checking it. Some doctors don't even know it exists because the bottom line is they haven't been educated for one reason or the other. And so we've set up these protocols, and in our practice, as far as we know, we've actually never had a death. Now, you know, I think, you know, that's by the blessings of God as well. And so, you know, but the point is you can use these medications, but what we're finding nationwide is there just hasn't been enough education. And you can walk in the doctor and say, my back hurts, and walk out with Percocet or OxyContin. And I think we need to start with educating at the medical school level, at the fellowship and residency level. That's where we train doctors, and at just the outside practicing doctor. If we start with education, I think we can get ahead of this issue.
People right now getting prescribed pain medication, maybe been taking it for a while, how do they know if they're doing the right thing or if they're in danger of doing it too often? And what questions should they be asking their docs?
Great question, Mike. I think a couple points. Number one is it's very important for them to be having these discussions with their doctor, to really ask the doctor the hard questions, ask them what the risks are, ask them if all the medications they're taking are appropriate. The two big points when I'm educating doctors and patients is the two most important things on knowing if what you're taking is safe. Is number one, the dose that you're taking, and I'll come back to that in a second. Number two is which drugs are you mixing together. Just to focus on the second point, the mixture, one of the biggest problems we have is when patients are taking a pain pill, a sleeping pill, an anxiety pill, maybe a muscle relaxant, all at the same time. And we call it a synergistic response, where sometimes one drug by itself might cause a little bit of decrease in breathing, another one by itself might cause a little bit of a decrease, but when you combine them together, it leads to death. It leads to the person just stops breathing at night. And the best example of that is when you take a pain pill and you mix it with an anxiety pill. When you mix those two together, we call it synergistic respiratory depression. And when I see patients with that, I go to great lengths to educate that that can sometimes be a very high-risk cocktail. Now I'll come back to my first point, which is dose. And it's really hard to teach the lay public about which dose is right and which dose is wrong. So what I really recommend they do is sit down and talk to their doctor about their dose. But we know from the research that if you get above certain doses, the risk for death goes up exponentially, which is kind of like Richter scales, you know, like, like an earthquake, a 5 earthquake versus a 6. A 6 is actually 10 times stronger, not just, you know, 1 time stronger. That's the way it happens with pain pills too. Once you hit a certain dose, the risk of death goes up exponentially, and that dose is about 100 milligrams a day of morphine equivalent. Now where it gets a little bit complicated is morphine is like a base drug that we use for measurement, and every drug is measured against that. So you really have to sit with your doctor and talk about exactly what you're taking and understand it. But the truth is, we know the data. We're starting to get it in from the studies. And a doctor who's well informed that really is working with you, he'll sit and talk to you, tell you what your risks are, look at your medications, see if maybe it's not a great idea to take the sleeping pill and the anxiety pill and the pain pill. But those are 2 things I talk to patients about, is the dose and also what they're mixing it with.
So are there some drugs more dangerous than others, or are opioids pretty much all the same level of danger if taken in the wrong dose or in combination with other drugs? It's
a good question. So what we generally know about opioids is all of them are very high risk, and it really comes down more to dose than the actual class of drugs. From some of the research, it looks like the drugs that are really long acting, like methadone, we've tried that in pain management, that it actually is higher risk, and it probably has something to do with how long in nature it is. But in general, anytime you're on an opioid, I think it's important that the doctor sits and talks to you about there are risks associated with this, and one of those risks is death. And we've said that, you know, word a couple times on the show, but people in my clinic like to joke, if I'm meeting a patient for the first time who's on pain pills, I'll say death 2 or 3 times on purpose during our intake, because I want to make sure when they walk out of there, they understand the seriousness of the medication they're taking. I had a patient today who came in and talked to me, and he gave me permission to use this story, and he said he read the article in the LA Times where they talked about 4,000 deaths over a 5-year period. And he said one of the patients that they talked about in the article went home, drank some alcohol, and never woke up. And he said, you know, I never knew that. And I drink alcohol every once in a while, and I know you're not supposed to, but I always just figured it was like a suggestion. He's like, that changed my mind. I'll never drink again. And I'm like, well, I'm glad you read that, because I didn't know that you had been drinking. And so it's really important that we understand how high risk these medications can be.